Hello, my name is Dr. Jeffrey Klein. I'm a dermatologist and a clinical pharmacologist. I'm particularly interested in treating severe dermatologic pain. One of my favorite projects is treating herpes zoster, which can be one of the most painful conditions that there are that involves skin. This is the HK Surgical Klein Tumescent drug delivery pump, the Klein TDD pump. This was designed specifically for treating the most severely painful dermatologic skin conditions, including herpes zoster and hidradenitis suppurativa. These patients are often in such pain that you can't even touch the area that is being treated or targeted. So this allows me to do that in a very painless fashion. So this pump allows me to regulate the flow rate in terms of 1 RPM. It's down to 1 milliliter per minute, up to 600 milliliters per minute. And that gives us a wide range, but it allows me to infiltrate using the very smallest needles. And I can put in a 32 gauge needle into a painful area and the patient doesn't even feel the needle going in. But this is the only pump that can allow you to do that with sufficiently slow RPM. So I'll give you an example. So here the power is on, it's getting power to the pump, but the pump's not on yet. Push that, now the pump is on. And when we have a tubing in here, we put tubing in here, and that takes fluid from an IV bag or a reservoir bag of these drugs, and it pumps it in down the tube into the hypodermic needle and then into the patient. And I can select the different RPMs here. So I want to start off using 6 RPM. I can go faster. I can go a little faster and get a higher RPM if I'm treating a big area. For example, an entire dermatome along the chest wall. So that's the pump. This is absolutely essential for treating herpes zoster using the Tumescent technique. If you're using something else, you could do harm to the patient, and I don't want to be associated with that. So, turn that off. These are the drugs that we're using to make the solution. I'll show you later how these are mixed. But it's a very specific protocol. Doing drug compounding in your office is an essential part of Tumescent drug delivery. You cannot have this done in a pharmacy. It's just totally inconvenient and often not safe because pharmacists don't know anything about this, and I cannot feel comfortable that it's being done in the correct fashion. So we do it here and under very strict protocols. This is a cyclovir. The FDA says that this should not be injected under the skin. So if you use this, it's not only off-label, it's very off-label because the FDA tells you not to do it. However, I've found out that if it's sufficiently dilute, it's very safe, and if it's sufficiently concentrated, it's very, very effective. So there's a very specific sweet point that is effective for this.